Good evening and welcome to this week's Black Mental Health is Black Health. I'm your host, Bronwyn Lucas, Ms. B, the Black Couch Therapist, and we have an exciting guest. Well, all of my guests are exciting, and tonight will not disappoint. But if you're here for the first time, we always start off with some deep breathing. Why? Deep breathing allows you to take some more oxygen to your brain throughout your body, allows you to decompress and have that woosah moment. So, we're going to take 3 deep breaths and jump right in. Let's go. I will count you in very slowly to 4. I'll say breathe in and very slowly breathe out. And we'll just take these breaths and have that woosah moment. Let's get started. Breathe in, 2, 3, 4. Out, 2, 3, 4. In, 2, 3, 4. Out, 2, 3, 4. One more. In, 2, 3, 4. Out, 2, 3, 4. Well, Dr. Tosin, how was that breathing for you?
It was great. I love the extra oxygen to the brain.
Yeah, so that's why we always start out with that. I like to remind my guests that's something you can do for yourself any time of day. When you find yourself a little stressed, stop, take a few deep breaths. It can make a big difference in your life. So you get to tell us who you are and something cool about yourself.
All right. Well, I am formerly known as Dr. Olutosin Bisiriyu. I'm a mobile chiropractor here in the DFW area. Something cool about myself. I was really trying to think about that prior to this. But the only thing I can really come up with, I was like, it's going to be an in the moment thing. And the only thing I can really think of is me being first generation Nigerian. I think that is pretty neat. So yeah, I would say that's something cool about myself.
That is cool. So you were born here and your parents were born in Nigeria?
Correct.
Do you get to go visit Nigeria?
I do.
Okay.
I do.
That is cool. That is cool. Awesome. So we're going to jump right into a chiropractor. What is it? But so I want you to tell me, what does a chiropractor do? Just who is it? What do they do?
Okay, let's start with what is a chiropractor, and then I'll kind of segue into what we do. So, formally, I would say a chiropractor is a healthcare professional who treats conditions related to the musculoskeletal system. So, the system comprised of the muscles and the skeleton. As chiropractors, we deliver adjustments, which is a specific force to a joint within the body to help restore function primarily. So that's pretty much what we do in a nutshell.
So what exactly is an adjustment? I know we've heard that term. Can you break it down a little more? What are you adjusting? What are you doing?
So we're adjusting the joints. So anything that has a joint, I would say as small as the joints within your fingers to the bigger joints within the spinal column. People are more familiar with the joints within the spinal column because we think of neck pain, back pain, and those I would say are the more common conditions people come to us for. But I don't want to neglect the other joints like the shoulders, the elbows, the knees, even down to the feet. Like I said, anything that has a joint can be adjusted. So that adjustment is that specific force into that joint to help restore motion.
Before we get even deeper into some of the things a chiropractor can do, what made you want to become a chiropractor? Of all the things in the world, why that?
You know what? A lot of us within the profession say chiropractic chose us. It's not something that was on the forefront of my mind. I didn't know anybody who was a chiropractor. I never really even paid attention to chiropractors that were in the community. But when I started actually working for a chiropractor as an assistant, And that was my introduction to chiropractic, was working as an assistant. And that's where I received my first adjustment. And that was pretty life-changing for me because I had been experiencing some breathing issues that would happen kind of sporadically. And I went to the medical doctor and they would just like write it off as like a muscle, some type of muscle something. And they would give me medication and kind of send me on my way. Thankfully, it was on my right side, because at times I would feel like I was having a heart attack, because, it felt like that. But when I went to the chiropractor that I was working for, he delivered an adjustment to my ribs. So it was actually just a rib that was out of position. And once he adjusted me like twice, I, knock on wood, haven't felt that since. Yeah.
Awesome. What is the training like to become a chiropractor? How many years of school? There may be someone who's thinking about a career changer, what is it? What is that path like?
So for me, I did 4 years of undergrad. As I did a kinesiology major, but I'm sure almost any science major can transition into going into chiropractic school. But yeah, I did 4 years of undergrad as a kinesiology major. And then from there, I went to Parker University, where I obtained my chiropractic degree. And that was an additional, let me say 3.75, but I say almost 4 years.
How long have you been practicing as a chiropractor?
I've been practicing 10 years now.
Oh, wow.
Yeah.
So, this show deals with mental health, and it is my contention always that mental health and physical health are linked, and you can't link them. It's just health. And you impact one part of your health, you impact another part of your health. So as a chiropractor, adjusting your body, the physical side, can that have any impact on our mental health?
Definitely. I always equate stress and mental health and physical health kind of as, I equate it as one. They can go hand in hand. You have your acute stress and you have your chronic stress that are typically caused by what we call the 3 T's, the toxins, the trauma, and the thoughts. So the thoughts is where that mental health component comes in, right? So we have your good stress and your bad stress. You have that good stress that, you see a bear come in, you're running, it's alerting you to run away. That's good stress. Then we have our negative stresses, which comes from the trauma that you can see, the toxins that we input to our body, and then I would say the invisible stress, which comes within our thoughts, right? And those, all 3 can cause that subluxation or that misalignment within the body or within our bones, right? And that's why we want to come back and produce the adjustments to help alleviate that. So I think it all goes hand in hand, because pain can also cause stress, and that in tune becomes a vicious cycle, which which impacts the central nervous system, right? So I think everything, like you said, is just interrelated. We have those stress factors that kind of knocks us out of our homeostasis, our mind-body balance, and then we need to find things that can bring us back in line, bring us back to that point of homeostasis. So when we're talking about those thoughts, that's when mental health comes in, to see, is there something more deeply rooted, because I'm adjusting you, and these bones are not going back into position. What else may be going on, outside of just that physical trauma that we can see? And then also toxins, what are we inputting into our bodies that, can also cause that internal stress? So these are the different things that we address. So for me personally, I'm not only addressing the misalignment within the bones, but I also want to address the muscle, making sure that's relaxed, making sure that's tension free, because that attaches to the bone. So if that is tight, if there's tension there, then it's tugging that bone out of position, right? And then I also want to say, okay, putting my pride aside, if my adjustments aren't working, what else can be going on? And that's where the mental health comes in.
You said that stress can cause pain, and it's a two-way street. Pain can cause
stress.
Yeah,
Mm-hmm.
You said a lot. It's part of the definition, even of anxiety. Anxiety has physical manifestations in our body. When you are stay in that anxious state, you can have stomach problems. You can have, like you said, tension in your neck, tension in different parts of your body, because you're staying in this constant state of anxiety. In our world right now, life in America, being Black in America, it's stressful.
Yeah.
Yeah, life in America is just stressful.
Indeed.
So let's say it's anxiety produced pain, because it literally can be pain. Like I say, some people carry their stress in their shoulders, and it feels like your shoulders are like up here because it's
correct.
And if it's stress, it can be having an adjustment assist with that if it's more of a mental thing?
It can, to an extent. Will the adjustment hold? That's a toss up. It may not, because if you're constantly in that state of tension, then those muscles are constantly tight, then we're kind of doing the body a disservice. We have to get to the root cause of the problem. If the root cause of the problem is a mental health issue, then we need to refer to the right provider. If the root cause of the problem is from toxins, then we need to refer to the right provider via possibly a nutritionist. And then if the root problem is a musculoskeletal condition, then that's where we come into play. And then the likelihood of that adjustment holding is greater. But yes, if you do have that mental stress, it's hard for the body to be in that relaxed state.
Sounds like you're a pretty holistic professional, in that it's not like, oh, just come to me, I can fix everything. No, that's not plain.
Correct.
When you look at the whole body, I like that. So tell me about that holistic point of view you appear to
have. Honestly, I feel like that is kind of the core of chiropractic. We're wellness providers. We shouldn't only be looking at just those spinal conditions. We shouldn't just be focused so much on the adjustments that we neglect the total person. And that's where, honestly, I feel like Axon Health kind of differentiates itself from other providers, in a sense, is because we do look at that whole complex. We're looking at your mind, we're looking at your physical, we're looking at, different factors that make up that human. And we want to address that as a whole, because, we're not just one focused, we're a whole spectrum of a human. We're not just one thing, So you have to look at those different conditions to give that patient the benefit that they deserve.
Awesome. So tell us about Axon Health. Is this your company, a company you work for?
So I'm actually an independent contractor. So it is technically would be a company that I work for, more or less like a franchise. So yeah, I independent contract with them, and then I represent the state.
So when you go out, now you are a mobile chiropractor. Explain.
Yeah, so I like to say I'm the chiropractor that comes to you. So I try to provide that convenience of you imparting me into your life instead of the other way around. I want to save you gas. I want to save you time. I want to save you just the energy of having to leave your home and go to an office and wait and then be treated, So that's what I do. I come to you. I come to either your home, your office, or just about anywhere you'd like me to come. And provide those services.
So you have to come with table with what do you travel with?
Indeed, I travel with my table and some tools that I may possibly use during the visit as well.
Do you find people like that better than having to go out?
Honestly, I think it varies. You know, there's some people that really enjoy it. As of lately, I've been seeing a lot of pregnant women enjoy it because they can minus an appointment, minus a doctor's appointment. You know, they have to see the OB-GYN frequently, further along they get in pregnancy. So to minimize an appointment is definitely a perk for them. And then you have individuals who just like what an office setting provides. You know, they like being social in that respect. So I would say it varies. It varies. Some people do, some people are a little hesitant.
And I would say that's similar to a mental health professional. So I do virtual therapy and I do in person. And there are some people, no, I have to be in person. No, I don't really want to go outside.
Right.
You know, camera. Can I meet on the phone? I said, okay, let's at least be on camera so we can see each other. And then there are some people, it depends on the day. Being this week, I want to stay home this week. And I am open because, like you say, it's about their comfort. Which do you want to do this week? You know, I confirm in the beginning of the week, are we going to be virtual? Are we going to be in person? Then I can govern myself accordingly.
Indeed.
It's true. So it seems like it's that same mentality, and it makes sense. It's about comfort zone. You know, and it's no right or wrong. It's your comfort zone. So look at what are some ways that a chiropractor can impact just our overall health? We talked about mental health. Are there other ways when you talk about toxins and releasing toxins, how can that help impact our overall health?
So in relation to just the chiropractic component as a whole, essentially what the adjustments are doing is giving the central nervous system a boost, right? So the central nervous system is comprised of the brain and the spinal cord. And then we have the vertebral column, which are the bones in the along the spinal structure that helps protect that brain and spinal cord foundation, right? So when we're delivering that adjustment, we're taking pressure off the nerves that come out of that column, right? And essentially, when you're taking off that pressure, you're allowing that central nervous system to function at its maximum. So that's really what we're doing with that chiropractic care on a deeper level, you know, outside of just the pain and minimizing the stress in the muscle. We're really giving that nervous system freedom to work at its maximum.
And having that done can have, I would think, a major impact on our overall health.
Indeed. Because that system regulates everything that we do, from movement to breathing, you know, everything. Everything.
What ages do you treat?
Right now I'm doing 9 and up, but I am going to start expanding that once I get additional certification.
So working with younger children requires something different?
Yes, I would say yes, because there are pediatric centered or focused chiropractors, and they do extra training, get extra certifications to comfortably do what they do. So I would say yes.
Youngest a chiropractor would treat?
Honestly, a newborn. You see chiropractors treating children right after birth. Yeah, just because of the trauma that the baby goes through during birth, coming out of that birth canal.
What's the youngest you think you want to treat?
Honestly, I am becoming more and more open. I think once I became a mother, I was like, oh yeah, I see the impact and the benefits that it has. So I'm becoming more open to infants.
Okay. How old are your children or
uh,
child children?
one child, she's 4.
Still in that fun, running around, lots of energy age.
Yes.
When just in looking at this, when someone is considering going to a chiropractor, what should they look for? This is new to a lot of people. I personally know people who regularly go, and I know people that I don't know about that. So if someone's new, what are some things they should look for? What is maybe a checklist of things?
It's hard to say because I feel like at our foundation, at our core, we all do the same thing. But there are specific specialties. You have people who work more with pediatrics, the pediatric population. You have people who work more with sports. You have people who work more for just general maintenance. So I would think it would just depend on what specifically you're looking for. Are you looking for wellness? Are you looking for pain relief? Are you looking for injury-based chiropractor? I think it just depends on what you're specifically looking for.
And what would be your specialty of the things you mentioned? Or are you more of a generalist?
Honestly, I would say if I had to say specialty, it would be more in personal injury because I had 9 years of personal injury prior to branching off with Axon Health. So if we were to say specialty, by default, it would be personal injury. But I am moving more into wellness maintenance at this juncture in my life. But I'm not opposed to the personal injury.
So what does that look like? Car accident, just in my ignorance, is that like someone who's been in a car accident or
Yeah.
type of trauma?
Yeah, that's typically the majority with personal injuries. It tends to be car accidents, but you also have slip and falls. You also have dog bites. I've seen a couple people with that. Yeah, you have any type of trauma, any type of injury.
More explanation on dog bites and chiropractors. So explain, please.
Well, it can injure the muscle, depending on how deep the penetration is with that dog bite. It can injure the muscle, can injure the tendon, and then if you fell after getting bitten, that's another type of trauma to the joint. So you have different factors within that bite that can cause us to be the provider of choice.
Never would have thought of that.
After, of course, what I would recommend going to the urgent care and yes, getting that component taken care of, the open wound. And then afterwards, if there's still pain, discomfort, then we're here to also treat the musculoskeletal component of that.
What are some other things that might affect us in a skeletal muscular way that we wouldn't think of? Dog bite is one, and when you explained it, makes perfect sense. You get the bite itself healed, and if there's some still things misaligned in your body, you need to have them fixed. Is there something else you could say that we might think is unusual, and you're like, oh, that's normal?
Honestly, I would feel I'm just in my, my little 9 year or my little 10 years. I would say that one was probably the most peculiar. But slip and falls too were one that I'm like, I didn't really think we would be the first provider of choice, but now I get it. Once you fall, you can cause things to go out of alignment. You can injure a muscle, you can sprain a muscle, things of that liking. So, yeah, those are the only ones I can think of off the top.
I can see the slip and fall. I am on the top 10 list for most clumsy people in the world. Yeah. Do something, you should do it well. On flat land, Some people can't navigate rocks and all this stuff. Flat land sometimes, it's always been that way. It's like there's nothing there. What did you take over? The air. Yeah, it's my friend. So actually, I'm getting better with old age than I was with young age. So I see where that, that slip and fall, could make a difference.
Yeah, and I would also say headaches too. That's the one that's commonly overlooked with chiropractors, that we can address headaches as well. Just because of that pressure that's being placed on that nerve, that can translate into the headaches, or even just pressure in the neck that can translate into headaches. People sometimes forget that we can treat that as well.
I wouldn't have thought of it. And I do remember, yes, someone I know who said it was amazing because they were tired of taking medication for headaches and working with a chiropractor. I don't remember anymore how bad it was. So yeah,
Mm-hmm.
it definitely seems as if coming to a chiropractor, it can be for the right thing in terms of pain, an alternative to continuous medicine. You know, a lot of people don't want tired of taking medicine. So it seems like, am I right or wrong about it?
Yes, I would say that it's a good option when you get to the honestly before you get to that point. Yeah, but I would say, preventative care is always better than sick care.
Right.
And the goal is to wean you off that. Granted, it matters, it depends on the condition, of course, but yeah, if it's not something that is compulsory, then the goal should be to, remove yourself from what you don't need per se. So that's, we can definitely work on other supporting factors that may help wean you off, those medications.
And I see chiropractor as we talk is just something else to have in your toolbox.
Say that again.
I see this as something else to have in your personal toolbox for mental health.
Indeed. Yeah.
Like you say, there's some things, yes, you're going to need medication for, but there's some things that the proper alignment might treat it. So I think it could be an important thing to have in your personal toolbox for your overall health.
Indeed, I would totally agree. At this point, I say everybody should have a chiropractor in their toolbox.
You should have a mental health professional.
Indeed.
This is what we do. I think it's real.
Yes.
We need a broad view of who we are. We need a big toolbox. You need a good PCP. One you can trust.
Yes.
So for a woman, you may need a good OB-GYN.
Mm-hmm.
And so you need all of these people, and I keep adding someone you can trust because you're giving your health, your life over to this person to help you. So that trust is important. Indeed. But it does need to be a pretty large toolbox. We get caught in Western medicine and thinking it's a nice little bitty box.
Mm-hmm.
Toolbox and put lots of people in it because, as I say, health is health. Mental health, physical health, it's all health, and we need to work on it.
Yes.
Well, as we near the end of our time, are there some final comments you'd like to have?
Oh, that's good. Final comments. Let's see. I would say just regular chiropractic care helps to decrease pain and relax muscles, increase joint mobility, and just aids in improving your overall quality of life. I like the term motion is life, movement is life, and that's what we're here to continue to help the body do, is move those joints, so we can continue to have life.
And how can someone find you?
You can visit my website at www.myaxonhealth.com, or find me via email, and that's Dr. Bisiriyu, Bisiriyu, BISIRIYU at myaxonhealth.com.
Well, thank you. We like to end every week with a call to action. And my point regarding this is Have a big toolbox for your mental health, for your health, and include a chiropractor. Don't discount it. Find out for yourself. Here's a great one for you to check out. Check it out. Get that toolbox bigger and bigger. We are responsible for our own health. And the second point will always be vote, vote, vote. Be an educated voter. We live in a time where it's even more important. I think every day becomes more important.
Indeed.
Just during the election cycle, be aware of what's going on and how your vote may matter. So I am Bronwyn Miss B, the Black Couch Therapist. I am here to help you become a better you. And I will see you next week. Thanks again, Dr. Toast.
Thank you.